Hello, and thank you for that introduction, Karen, and thank you to the team who's made this pivot to a virtual convening possible. I'm pleased to speak with you today and tell you a bit more about the Patient-Centered Outcomes Research Institute, as well as patient-centered outcomes research and what makes it different from the traditional research paradigm. And I'll also share a bit more with you about our growing maternal health portfolio. Next slide, please. Next slide, please. All right, next slide, please. All right, thank you. So first I'll start by telling you a bit more about PCORI, where I work, and I'll get into basically our founding as an independent, non-profit, non-governmental organization founded or authorized by Congress in 2010. As an organization, we were reauthorized in 2019, and we fund comparative clinical effectiveness research that engages patients and other stakeholders throughout the research process. It also supports work that will improve the methods used to conduct such research, like patient and stakeholder engagement. So for all the advances that it produces, traditional healthcare research has not always answered many of the questions that patients face. And we want people to know and have an understanding of what is the best option for them. Next slide, please. Thank you. So patients and their clinicians need information that they can understand and also use. And PCORI seeks to support those efforts focused on answering some of those questions. And in these efforts, we seek to answer real world questions and those that work, answering questions related to those that work best for patients given their circumstances. And also, I understand that we may have some attendees from outside the US, and I wanted to make sure that you're aware that foreign organizations can apply to PCORI for funding if there's a demonstrable need or benefit to the US healthcare system. And then also one of the other key issues is to ensure that the engagement plan that will be used in that project will include US patients and stakeholders, and that that project idea is relevant to the US healthcare system. Next slide, please. All right, so as I mentioned before, PCORI works to answer patients' questions. And so patients may sometimes ask what they should expect will happen to them if they take a specific medication or they use a specific diagnostic treatment. They may also question what options are best for them and what are the potential benefits and harms of those options that are presented to them in a healthcare setting. They may also wonder like how, what they can do to improve the outcomes that are important to them. And then also their clinicians may need information that helps them to make the decision of what's best for them in their healthcare. Next slide, please. So PCORI pays close attention to conditions that heavily burden patients, families, and or the healthcare system. We focus our funding on chronic and or multiple conditions, rare and understudied conditions, and then also conditions with varied outcomes across subpopulations. Next slide, please. So this next slide, I wanted to share with you a new resource that PCORI has made available on our website. It is the Research Fundamentals Learning Package. It's a training that you can, as I mentioned, find on our website, and it allows you to move at your own pace. And the next few slides show you just a sense of some of the screenshots of what you could see. So there are 5 interactive learning modules, and those modules provide foundational knowledge for PCOR and CER. And this here shows you those 5 modules. So developing research questions, designing a research study, sampling, recruiting, etc. Next slide, please. So in this next set of slides, I'll be sharing a bit more with you about our growing research portfolio. And so as you can see on this map here, we have awards that we funded in 49 of 50 states, including DC, the District of Columbia, and Puerto Rico. So the state that we have that hasn't received any funding just yet is North Dakota. So if we have anybody who's participating in this webinar, who's from North Dakota and or has partners in North Dakota, we would certainly love to receive some applications from you all. All right, so we've funded 1,700 projects for more than $2.8 billion. And this slide here just shows you some of the heavily funded healthcare areas. And so you can see the primary condition is mental and behavioral health, and then also cancer is the number 2 condition. And as I mentioned before, we have a high priority on conditions that affect large numbers of people, that place a heavy burden on individuals and society, as well as rare diseases, which may be difficult to study. Next slide, please. So thus far, we've funded about $57 million in CER studies, or comparative clinical effectiveness studies, related to maternal health. So out of that $57 million, there are 18 studies on maternal health. And next slide. This slide shows a little bit more about our evolution as we are trying to bring more voices into the maternal health forum. So this past year, or last year, as I mentioned, PCORI was reauthorized, and in that reauthorization, we received a new national priority. So maternal health became, or maternal mortality, I should say, along with morbidity, became a national priority, also along with intellectual and developmental disabilities. And so as a result of that, we are, in recent times, we had a recent funding opportunity that was made available where there was special emphasis put on projects that we received for maternal mortality, as well as intellectual and developmental disabilities. So PCORI is continuing to engage with Congress and other stakeholder organizations to ensure that we can hear the important voices and bring them into the discussion. Back in the fall of 2019, there was a multi-stakeholder maternal mortality salon, which Karen actually took a part in. And then we've also had a listening session with the Black Maternal Health Caucus. And we recently had scheduled to have a maternal mortality stakeholder meeting. However, that was put on hold pretty much because of the pandemic that we're all going through right now. So, you know, our hope is that the information that we hear in having these conversations and making a space to hear from stakeholders in maternal mortality will allow us to have a better understanding of the current landscape, and then also continue to build relationships and identify new voices. Next slide, please. So before I close, I wanted to give you all an opportunity to see what options we have for you to become involved with PCORI. We have our advisory panels, we have the ambassador program, merit review. We also have an engagement tools and resources repository. We also have peer review. And on the last slide here, and my understanding is that the next slide, please, the slides will be shared with you. There are links to these individual things that I've just mentioned for you to explore at your leisure. And so with that, I'll close and thank you for your time. If there are any questions, I am available to do my best to try and answer those.
Thank you so much for that, Courtney Clyatt. Fabulous introduction from PCORI, and hopefully others are just as excited as we are about the continuing support and opportunities to really try and ameliorate the problems that we're seeing in our clinics and the populations that we're concerned with birthing peoples in this country.